There is always a small risk regardless of why your dog needs surgery or anesthesia, but why wouldn't you take action to reduce their risk of complications and even death? Well, these 5 steps will help you to keep your dog as safe as possible if they need surgery, sedation or anesthesia. The first step is to actually optimize their health prior to having the procedures performed, and this can take some time, so it depends on why they're having that procedure, why they're being anesthetized, as to how possible this is going to be. But with 60% of our dogs classed as overweight or obese, and knowing that this increases their risks of complications, weight loss is definitely going to be the first step if possible. We can also better control any other additional diseases or any other problems that we know to be present. If they're diabetic, make sure that that is really nicely controlled. If they've got underlying skin disease, then make sure that there's no secondary infection. Really focus on just making sure they are as healthy as possible before they have that procedure. But then the other consideration is actually having a surgical procedure carried out before they get too old or before their health deteriorates. And I see this a lot where people are really worried about the risk of surgery, so delay a procedure only for it to be needed 6 months, 12 months, 2 years later when their pet is older and when their health is less optimal. Actually, it would have been better to jump in sooner rather than leave it to this stage. The next way to reduce risk is to actually have some pre-surgery medications. This is especially important for our brachycephalic dogs, our squash-nosed dogs, where they are at a higher risk of what we call aspiration, so where they maybe regurgitate and then they breathe that into their lungs, which can be catastrophic. So we want to maybe be giving them anti-vomiting medication, gastroprotectants, so things that will stop an esophagitis, stop any reflux. For diabetics, we want to make sure that we are giving them the appropriate dose of insulin. Obviously, your veterinary team will talk to you about that. If your dog is on any other long-term medications, then should you withhold that on the morning of the surgery? Should you actually give that? It's really important to be clear, and talking to your veterinary team is crucial for this. And this comes on to the next safety step, which actually is on the day of surgery, that we can take some really big actions to make sure we're keeping our patients, our pets, our dogs as safe as possible. And these are again things to discuss with your veterinary team. So we want to discuss fluid therapy. It's definitely a good idea to have an IV catheter placed and have IV fluids running. It helps support blood pressure. It helps provide an open line, what we would call open access to the blood should we need to give an intravenous injection. There's nothing worse than a dog struggling under anesthesia or sedation and not actually having a catheter in place, and then your vets, your team are scrambling around trying to get a catheter placed while your dog is potentially crashing and dying before their eyes. Fluids is a really good idea. Can we do some blood tests beforehand? So a pre-anesthetic blood test, just to check that there's no hidden problems going on. You know, every surgical patient should have a full physical examination happen before they are anaesthetized, and this is a really good check of general body health. But actually, to check organ health, we need that blood test, and it can be really crucial, especially for our older patients, where there's definitely more value in it of having that done a few days before they have their procedure or on the morning of the procedure. We are really lucky in that as veterinary clinics, most clinics will have blood testing equipment in their building, so they can get results very, very quickly within about 20-30 minutes of taking that blood test. It doesn't need to be sent off to an external laboratory, which can take several days. And then we need to be thinking about fasting our dog. So this again helps with reducing any regurgitation and any risk of aspiration. There are going to be some exceptions to this. So if we have got a diabetic dog, it may be that we don't want them fasted, or we want them fed a little bit later than they would otherwise have been fed. If we've got any young dogs, if there's any other concerns, it may well be that there is a different instruction that is given by your vets. So the next check that you can carry out is actually checking the staff involved. So what qualifications do the nurses and technicians have? And in different parts of the world, there's different regulations about who's able to be called a veterinary nurse or a veterinary technician. And it doesn't actually necessarily mean that they are qualified to any degree, but also to what degree are they qualified? What skill levels do they have? How many members of staff are going to be involved with monitoring the anaesthetic, with looking after your dog in the post-operative period, which is actually where one of the biggest risks is. So definitely check that out. And then at the same time, you can ask about facilities. So what facilities does your vet clinic have? You know, do they have these blood machines that we can run that pre-anesthetic sample the morning of that surgery? Do they have advanced monitoring equipment, things like a pulse oximeter, which checks how oxygenated the blood is, capnography, which checks how well a dog is breathing, an ECG, which shows any arrhythmias, any possible problems with their heart. All this equipment does add extra cost likely to the bill, but actually it helps improve the safety of the anesthesia to a really huge degree. And this is actually where it's important to almost disregard cost as a decision maker, or certainly disregard the lowest cost and going for that option, because if a clinic is providing the same surgery in inverted commas at a much cheaper price, we've got to ask ourselves, what corners are being cut? Are there qualified staff? Is there any monitoring equipment? Is different surgical kit being used for every individual? We really don't want to be going by price alone when it comes to deciding where it is best for your pet to have their surgery, regardless of what surgery they're having. But then the other, potentially even most important consideration that you can have is, does your dog even need surgery? It's really a case of risks versus benefits, and I discussed that more along with their risk of actually dying under anesthesia in this video linked on screen. So tap on that video, I'll see you there. But until then, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.